Hello and welcome to Medtalks with Dr. K.K. Agarwal. I am Naina Agarwal Ahuja and this is the non-stop discussion on infertility treatment during COVID-19. Hello, I'm Naina Agarwal Ahuja and you're watching Medtalks with Dr. K.K. Agarwal, non-stop, 293rd edition and cumulative 2441st edition. Let's have the headlines of the day. Roche receives emergency approval in India for its investigational antibody cocktail for the treatment of COVID-19. Indian doctors in the US offer virtual help to COVID patients in India. Experts warn the rational use of steroids for COVID is a must to control fungal infections. According to the center's principal investigative officer, COVID 19's third wave is inevitable. Reliance seeks permission to fly in Israeli experts for training and installation of rapid COVID 19 identification equipment. Let's now go to the topic of the day. Let me introduce our special guest today, Dr. Rishma Dhillon Pai. Dr. Rishma is an honorary consultant gynecologist at the Leelavati, Jaslok, and Hinduja healthcare hospitals in Mumbai. With an experience of 29 years, she is the only Indian to have served as the president of all three leading gynecological, infertility, and endoscopy organizations: FOXY, the Indian Society for Assisted Reproduction, and the Indian Association of Gynecological Endoscopists. She is the first Indian to have been appointed as the board member of the World Endometriosis Society. She has received numerous national and international awards in her prestigious careers. Welcome, Dr. Rishma.
Thank you. Good evening. Pleasure to be here.
So, we're discussing managing pregnancy and infertility treatment during COVID 19. So, Dr. Rishma, I want to really start by asking, do you think this is the right time to conceive or to plan infertility treatment at all?
Difficult question. It's such a personal issue as well as, there are no clear guidelines worldwide. Let's start by saying that nowhere has really, international guideline has said that you should not conceive during this time because so many natural conceptions are happening every day. However, times are bad, but this is not getting over in a hurry. So I personally would feel that those who are older, those who have little less, for example, ovarian reserve, those who have some problems such as endometriosis or some problems which are affecting their fertility. In other words, those who need to get pregnant in a bit of a hurry should get pregnant for sure and not allow this pandemic to postpone your pregnancy. However, those who are very young, who don't have any problems, maybe just recently married, maybe they would choose to wait for slightly better times or till they are fully, protected with vaccinations, etc.
What about infertility treatment? Because that requires a lot of hospital visits,
Yes.
a lot of physical interaction. What do you
Yes.
think about that?
Yeah. So see, when the pandemic first hit last year, everybody stopped infertility treatments because we felt that, okay, let's prioritize other health issues rather than wasting resources on infertility management. However, about 2 months into the pandemic, all international organizations felt that even reproductive rights or reproductive choices are an equally important healthcare matter. It's not like you can just push having children into the sidelines and concentrate only on saving lives. So 2 or 3 months into the pandemic, with great care, with proper guidelines, how to restart IVF came into being. And so last year in the month of May, June, we restarted our IVF centers all over India. And we went pretty carefully. We changed everything. We changed our consulting rooms. We changed our operation theaters, our labs. We equipped everything with all that is needed to protect not only the patients, but the doctors and the staff and everybody. So we put systems into place, and it worked very well for many, many months. Unfortunately, this second wave has now hit us, and again lots and lots of people are getting infected. So again, cases are our IVF work is at a slightly lower ebb, but we haven't stopped the IVF work. All we are doing is, because our guidelines are now so well established, we are testing patients before we start the cycle. So before we are starting an IUI or an IVF cycle, we test the patients, not only the wife but the husband as well. And then halfway through, around 8th or 9th day of the menstrual period, we test them again. And then we do the egg removal if we are doing an IVF. Again, before embryo transfer, we may test her again. So if the patient is negative throughout, it goes well. If in the course of the treatment she becomes COVID positive or her husband becomes positive, then we obviously have a very good counseling session. We talk to them, and we may cancel the cycle if the patient is positive, and try to do our best to compensate her, reduce her costs in the next cycle. But if after egg removal, we've taken the eggs out and then she becomes positive, then we just freeze the eggs or the embryos. And those, we can freeze very effectively now, and we can use them in a later cycle. So I think systems are in place, guidelines are in place, and we are able to quite safely follow fertility treatments.
So you mentioned that people who may be slightly older, people who may need to conceive should. So if
Yes.
someone is deciding to conceive, if someone is in their early pregnancy, how do they
Yes.
manage during the COVID pandemic? What are the tips and tricks that they should follow to
Yes.
ensure a safe pregnancy, especially in the first trimester?
Yes. So the basic guidelines remain common for everybody, whether you're pregnant, whether you're not pregnant, because anybody can be at high risk. Nobody can really predict who will have a severe case of infection and who will be a mild case. So all precautions have to be taken at any time, and particularly if you're pregnant, then all the more so. So there's nothing like being in the house, protecting yourself, not interacting with outside people, keeping the social distancing, keeping masking. And nowadays with this second wave, the recommendation is double masking. So whenever you're out with people, it's double masking and distancing, and obviously hand sanitizing. So the basic guidelines remain the same. In pregnancy, it has, there's no sort of guidelines which have come out, or no paper which has come out which says that if you become pregnant and you get a COVID, the baby is going to be malformed or abnormal, or there's going to be some damage to the baby. There are no such studies. Of course, in the course of the pregnancy, we are worried that pregnancy being a slightly less immune, there's little less immunity in pregnancy. So we are worried that the patients might get a severe form of the infection. But our Indian experience in the previous wave has not been so bad. The maternal, incidence of morbidity and mortality has been very low in the first wave. In the second wave, it seems to be a little bit more dangerous, even for the pregnant patients. And so we have to be very, very careful to protect oneself. And there are lots of issues, I think, which we can discuss, whether vaccination should be taken, will that protect them? So all these issues are there, but basic care remains. And in the course of the pregnancy now, even the doctors have really modified management from the Royal College in the UK, guidelines from all over, all the international organizations, including our own federation, Indian Federation. We have given guidelines about how to reduce antenatal visits. So earlier we would see patient almost every month, so a patient would visit the gynecologist 10 times during her pregnancy.
Yeah.
Now the recommendation is to visit the doctor only 4 or 5 times maximum in the entire pregnancy. Most of the consultations are done on the phone, and when she comes to the doctor, she's obviously prioritized, she's not mixing with other patients, and that one visit used even to give her injections, to do her immunization, tetanus, if you want to give her Tdap injection, whatever has to be done in that one visit, everything is done, so that she steps out of the house minimally. And the good thing that has happened is because we have adapted so well to teleconsultations. So now a lot of the issues are being solved on the phone. Patients are monitoring that, they check their blood pressure at home, they do their oxygen saturations at home, pulse at home, and they do the blood tests. They get somebody to do the blood test at home. So a lot of the information can be shared, counseling done on the telephone.
So, is there a lot of? I'm sure there's a lot of fear amongst people who are pregnant. They're very
Yeah.
paranoid, very anxious. So, how are you dealing with that? With patients, how do you actually keep them calm and healthy during the entire pregnancy?
I
All the
agree with
negative news
you.
are
So much physical problem is there, and so much mental anxiety is there, and that part tends to get neglected quite a
happening.
lot, so there's a lot of stress. And now with this massive second wave, they are surrounded by people who are getting COVID, their family members, people, who live in their neighborhood, all of them are getting infected. So it is a lot of anxiety for the patient. And sometimes they're testing themselves multiple times. So I think we have to accept the reality. This has been going down over for more than a year now, and it may continue for another year or 2 years. We don't know. This is something we have to live with for a very long time, and so we have to adapt ourselves, and we have to always do. As it is in pregnancy, we tell them, do a little bit of exercise, take your walks, do some
Yeah.
yoga, do stretching, do some meditation. As it is in pregnancy, we tell them, have positive thoughts. So I think all this is reinforced a lot more now that there's so much anxiety in the air. So I think the entire family also has to support her, and she's constantly in touch with her doctor. So I am now, like, for example, if I was receiving 30 calls in a day or 40 calls in a day, otherwise this has doubled now, because constantly the patients call for various things, and it is my duty, or I feel really that I can support them even with a good conversation on the phone, that don't worry, everybody's going through this, and we'll come out victorious on the other side. And even as far as I told you about the antenatal care, that we've reduced face to face interactions a lot. But even you know for example, a sonography clinic, they have also modified. The sonography clinic tells the patient to bring her own pillow and sheets, for example, wear a double mask and shield and come. So everywhere UV lights are going on. So we are trying to protect the patient at every step. Even the delivery, we are trying not to deliver them in very, very busy hospitals where there are a lot of COVID patients. We are trying to deliver patients in smaller nursing homes where there's not much exposure to outside people. Everyone is tested for COVID before they come in. So we've created a little bubble where there is almost no infection. So right from their pregnancy to their delivery till they go home with their baby, we try to isolate them in the best possible way and make it very safe, this journey for them.
So, if someone does test positive during their pregnancy, could you tell us
Yes.
trimester wise what should someone do? What are the signs that someone should look at? What is the risk factor? In the first, second, and third trimester,
Yes.
what should they be doing in particular?
Yeah. So see, most of the studies we have been of patients who have had COVID in the second half of pregnancy,
Yeah.
because the pandemic is not that old. The
Yeah.
pandemic is just over a year and a half old. So by the time the studies come out, the cases are reported. It's not one, two patients who make
Yeah.
the rule. It has to be a large number of patients. So now we have many, many patients reported who have delivered, who got infected in the second half of pregnancy, who have delivered, who have breastfed their baby. So that information we have. And the one thing that is known is that there's a much higher risk of premature deliveries. So many
Mm.
patients, if they're getting COVID in the second half of their pregnancy, say second trimester, third trimester, many of them are coming in for premature deliveries. But this seems to be the only one common factor that has been found out, that preterm deliveries are common. Obviously, if they get a severe case of COVID, they tend to have a lot more respiratory distress, more respiratory symptoms, because I said earlier that pregnancy, the immunity is already a little bit suppressed. So some of
Mm.
these patients may take a turn for the worst. But very few
Mm.
studies have reported that these patients do significantly worse than patients who are, not pregnant. So more or less similar. First trimester infections, we really don't have much information. So those studies really haven't come out. It doesn't appear that there will be a damaging effect to the baby, because these are, viruses like influenza virus, and that has never been shown to cause severe abnormalities in the child. So I think this is something which we'll have to wait for. Time will tell what is the final outcome. But let's put it in summary like this: that there have been no major damages reported to the baby. There are studies showing that the COVID can travel from mother to baby through the placenta. That is happening possibly. There are some babies born in the world who are COVID positive immediately after birth, but very few such reported cases. But those who get COVID and they develop antibodies, those antibodies are traveling to the baby, and the baby is born with sort of protective antibodies, if you may. So, there are various things that are there, but obviously the whole focus is on trying to prevent infection during pregnancy.
So, what happens if someone does test COVID positive just before delivery? They're rushed into a delivery, and also, what about breastfeeding after? What are the guidelines for that? I can see on the chat box a lot of people are asking this question also, that
Yeah.
if they've recently they're breastfeeding mothers and they're COVID positive, so what is it that
Yeah.
they can do at that time? Should they stop breastfeeding completely? Can they still continue? What are the guidelines
Yeah.
for that?
Yeah. So if, just at that point when they've just delivered or are delivering, and if they're positive, of course, they have to be kept in a special facility because we don't want to expose everyone else to the infection. So this disease is, in that sense, terrible that it isolates people. Normally for
Yeah.
pregnancy and delivery, everybody comes together. Here with this infection, you have to really isolate everybody. And that's a very, very difficult thing for all concerned. But obviously then she has to be delivered in a special care facility. And there are various thoughts on the breastfeeding. If the mother is actively COVID positive, and there is nobody else to take care of the baby in the immediate family, then she has to take care of her baby. In which case, she has to double mask herself, hand sanitize every single time, and be very, very careful, on breastfeeding the baby. The ideal recommendation is that somebody else looks after the baby. The mother expresses the breast milk. So breast milk is given to the baby. Express the breast milk with all clean safety precautions, double masking, hand washing. You express the milk and give the milk to be given to the baby actually by somebody else, so that the
Mm.
mother and the baby are not in very, very close proximity.
Yeah.
And the moment the mother is now past her infective phase, then obviously she starts breastfeeding the baby directly. It has been found that protective antibodies do go across from breast milk also to the baby. So if she's actively infective, then you can risk infecting the baby. But if you've had infection, for example, in your pregnancy, then you've got antibodies, and those antibodies may go across to the baby and actually give some protective benefit to the baby.
I'm just gonna. There's a question, so I'm gonna, in continuation of this topic,
Yes.
ask this question. People are asking
Yes.
that if someone is pregnant or lactating, are they given something like, what are the medications that are being given? So, an ivermectin and doxycycline, will it affect the baby's health? Will it not? That's the question that was coming in since we were talking about this.
So
I thought I'll just.
doxycycline is not a drug that we recommend in pregnancy. We don't recommend that. There are many other drugs you can use. You can use azithromycin. That's quite safe in pregnancy. Steroids can be taken because that's something which is often given for COVID treatment. In fact, many times we give steroids, injection like betamethasone or dexamethasone to our patients for accelerating maturity in the baby's lungs. If a baby is
Hmm.
going to be born a little premature, we give those steroid injections. So that is not negative. Even blood thinning agents are given to many pregnant patients, particularly patients who had recurrent miscarriages, etc. Many of them are given what we call low molecular weight heparin, which is basically a blood thinner. In pregnancy, aspirin. Many pregnant patients are on aspirin if they're at high risk of pregnancy-induced hypertension. So, as a prevention for pregnancy-induced high blood pressure, we give low-dose aspirin, of course, to many of our patients. So, most of these drugs have been tested and tried in pregnancy for many, many years. Yes, ivermectin, relatively new drug. One doesn't know much about it. But like I said, there are good options that are available. Antibiotics, steroids, blood thinners, most of them seem to be fairly safe in pregnancy. So it shouldn't be a problem.
Just having a
And now the
caveat here,
treatments are
everyone.
very standardized. If I may interrupt, sorry. The treatments are now very standardized. In the early days when the patients came in, everybody was really worried because there was no standardized protocol of treatment. But now all across, the treatments have become pretty standardized. And of course, it's really a multidisciplinary approach. The gynecologist is there looking after the pregnancy, but there are physicians, there may be chest specialists coming in to look after the actual medical aspects of the COVID infection. So multidisciplinary approach, I think, will be a really adequate care for the patient.
I was just saying, I was just putting a caveat out there. While all of these drugs are safe, it's very important to consult your gynecologist and kind of loop them in and take any of the medicines in pregnancy only once they advise you to take it and not to self medicate
Yes,
at all,
yes,
because that can be very dangerous. Yeah,
yes,
yeah.
absolutely, absolutely.
My next question is around vaccination. So, can someone take vaccination if they're on infertility treatment, or if they're pregnant, or if they're breastfeeding? So,
Mhm.
these different categories of women, is vaccination advised for them yet?
Yes. So, all across the world, they have said that you don't need to do a pregnancy test before you take a vaccine. So, if a
Yeah.
girl, like for example, she's a married woman and she doesn't really know whether she's pregnant or not, it's too early in the cycle. Nobody has said do a pregnancy test, confirm that you're not pregnant, and then take the vaccine. So, you can walk in, take a vaccine, and it should be pretty fine. Now it
Hmm.
comes to when you're actually doing treatment for pregnancy. Supposing you're doing intrauterine insemination, or you're doing an IVF cycle, or you're going to have an embryo transfer, then what is the advice? So when there is a very low incidence of COVID going on, when the peak is not there, for example, I think you can go ahead and do your IVF treatment, and you don't have to really delay it from point of view of waiting for a vaccination, for
Hmm.
example.
Hmm.
But
Hmm.
with the incidence so high at the present moment, and if you are not a patient whose fertility is running out, or we spoke earlier about
Hmm.
categorizing patients into low risk and high risk. So if you're a patient who's not in a hurry, extreme hurry for pregnancy, you can take your vaccination, take your second dose, wait for at least 2 to 4 weeks minimum, and then do your embryo transfer or IVF treatment. Problem is in India, particularly, is availability. So right now we do have a bit of a shortage of vaccinations, so there's not easy access because these are young patients, and we've just started, vaccinating the younger patients who are less than 45 years of age. So many of them are not vaccinated. Some are postponing their fertility, some are not. So it's a little bit difficult. The pregnancy vaccination during pregnancy is a big controversy. Our Indian government has not given permission at this
Yeah.
moment for pregnant or breastfeeding ladies to have the vaccine. So,
Hmm.
at the moment in India, if you're pregnant or breastfeeding, you should not or will not be able to take the vaccine. However, worldwide, including I think just yesterday or today, the CDC USA has said that more than 1 lakh pregnant
Hmm.
patients have taken the
Hmm.
vaccine, and it is showing no negative effects, and you should safely take the vaccination. So also American Society for Assisted Reproduction, European Society for Assisted Reproduction, all the societies have said that pregnant women should be allowed vaccination because, like I said earlier, they are at slightly higher
Yeah.
risk of a severe infection. So it should be allowed. Our own federation, Indian Federation, has also very recently given guidelines that we should appeal to the government to allow pregnant and breastfeeding women to be given vaccination because it has been found that the protective antibodies go to the baby. So instead of being a negative, it may be a positive. The antibodies in pregnancy during breastfeeding may go to the baby if the mother is properly vaccinated and may protect the newborn baby as well. So we would advise, if the government allows it in the near future, that in pregnancy and breastfeeding you can take the vaccine. In infertility treatment, if there is no rush, if you are young, you can postpone fertility, then take your vaccine, and a few weeks after that,
Hmm.
start your
Hmm.
treatment. And if your eggs are almost over, your AMH is very low, you're already 40 years old, you don't want to delay, then you can go
Hmm.
ahead and
Hmm.
take your infertility treatment and take care that you're not exposed to the infection.
Shreya Jain is asking, I'm having COVID symptoms and my gynecologist says that these are mild symptoms, but during the CBC test, my platelets are decreasing. It's my 8th month. So if you could help advise what she should do.
Yeah. So there is, in pregnancy, one is, as it is, very cautious, very concerned because, things in COVID, can suddenly take a turn for the worse. So the
Yeah.
important thing is to be under constant supervision with your physician and with your gynecologist. Monitor very, very closely all your blood levels, your D dimers, your platelet levels, like you said, the oxygen saturation. Constantly monitor, and at the first signs of things deteriorating, immediately seek maybe hospital care. because you are worried, and this disease is such that can suddenly take a turn for the worse as well. So low platelets in pregnancy is definitely a cause for concern, because it can cause bleeding within any part of the body, and it can be a cause for concern. So depending on the level, the typical platelet value should be above 1.5 lakh. So normally it's 2 lakh, 3 lakh. Now if it's running significantly low, then definitely you have to be very concerned. And there have been situations in which sometimes deliveries have been done before time because of the mother's deteriorating condition. So it all depends on how your overall well-being is, how your condition is, and what the physician and the gynecologist feel about your condition.
Prince Kumar is asking, ma'am, my sister is 7 months pregnant and she was COVID positive 17 days prior. Now her CRP is 10 and D dimer is 1.67 mg by liter. Ma'am, if you can advise, I was giving Dexona and Lupinox 40 for 10 days. Is this something that she should be concerned about right now? Is the question.
So fortunately, she seems to be over the main worrisome or the risky period of the COVID. If it's 17 days already since the infection, she may have even turned COVID negative, or may have even still be positive but not infective anymore, and probably unlikely to show any worsening symptoms at this time. As far as the anti-coagulants, the blood thinners are concerned, she should continue them for a period of time, because we have seen that, even though the patient recovers, there have been incidents of clots 2 weeks later, 10 days later. So definitely for at least about 2 weeks or more, maybe depending on the individual cases, the blood thinners should continue. And the steroids, of course, as per the advice of the physician, depending on her unique situation, or it can be gradually tapered off and stopped like steroids typically are.
Deepa Sharma is asking, hello ma'am, I'm a lactating mother. If I stop breastfeeding my nearly 3-year-old, can I get vaccinated?
Yeah, so 3-year-old, I think it's a good time to stop breastfeeding anyway. Maybe a good idea. And like I said, at the moment, the Indian government is not allowing vaccination while breastfeeding, but as soon as they allow, you can do it. Otherwise, I would feel that it's a good enough time anyway to stop breastfeeding and go ahead and take a vaccination.
Dishma Mehta is asking, I'm 14 weeks pregnant and my COVID test has come positive, but my CT value is high. It's 33. Is there any danger to my baby? I'm very scared. If you can please suggest.
So fortunately, it's past the first trimester. And usually everybody is very concerned about the first trimester, because that's when the baby is developing from a one cell to an entire human being, right? By 9 weeks, the baby is entirely developed. After that, the baby literally just grows in size. The development is over. So by the middle trimester, the baby is fully formed, and we hope that if you have a mild form of the COVID, it will not cause any significant negative impact on the pregnancy or the baby. However, I think we can't rely too much on the CT value, because
Yeah.
it's not something which you can really go by and sort of be confident that that is not going to cause you a severe disease. So rather than that, very close monitoring, being in touch with the physician all the time, and checking for symptoms constantly, checking your oxygen, checking your pulse, your parameters, blood investigations constantly, may be a better way of doing it rather than going by the value of the CT.
Kashish Tyagi is asking, my relative is 3 months pregnant through IVF and is positive. Her CT value is 28 and D dimer is 478 by 500. Her CRP is 20. Should we be scared? What should we do? Is there any difference if she's conceived through IVF?
So let's say one thing, that IVF pregnancies are similar absolutely to a normal pregnancy. So only the way of becoming pregnant is different. Once you become pregnant, for the first few weeks, maybe some medicines extra will be going on. After that, there is no extra medicine, there is no extra support, treatment, nothing. It's a pregnancy like any other. So if she's a little bit more advanced in her pregnancy, 3 months or whatever you said, then there is no added risk because she's IVF. However,
Yeah.
her CRP is quite high, D dimers are high, and definitely she needs to be monitored very, very carefully for developing a significant infection. So, like I said, now standard of care is there. and more, let's be more vigilant. If a pregnant lady is having COVID infection, you need to be much more vigilant than if she were not pregnant. So good,
Some,
constant in touch with the physician and the gynac for monitoring.
Someone is asking, in case of surrogacy, what are the important things would be parents should be careful about?
So,
Is the
in
question.
what context is this? If you're worried that the surrogate will get COVID, then I think the situation is the same as any other patient. We're answering so many questions from patients who themselves have become positive despite all precautions. So, I guess the same thing applies to surrogate. I mean, what is a surrogate? It's the egg and the embryo from the biological parents. It's just given or put into the womb of another patient to carry it through. So now the surrogate is pregnant, and the same rules or same issues apply to the surrogate as applied to biological mother. So I think if you are having a baby through surrogacy, you just have to be very, very sure that the surrogate is taking all precautions, that she's given all the care to protect herself and your child, which is carrying.
So I'm going to take a last question of the chat and then ask you for some key takeaways from the session. Neha Tyagi is saying that I'm a 34-week pregnant person. What is it? What are the safety measures required while going for an ultrasound? What should I be careful about while going for my delivery? In hospitals, is the COVID ward and delivery ward separate? How is the baby safe after delivery in the hospital?
Yes.
How do we make sure the child doesn't get it? So she's
Yes.
got all the
No,
questions.
these are absolutely the questions which are going through every pregnant patient's mind at the present moment. And so, starting with the ultrasound, I did mention it earlier. And like I said, all clinics, including most ultrasound clinics, have adapted themselves to COVID. So they're already working very strictly on appointments. So there's no crowding. The doctor is fully masked and wearing his shield and everything. There is between patients, you are cleaning up or sanitizing the room. We are often asking patients to carry their own bed sheets and pillows if they so want, so that you're not using reusing
Yeah.
anything. And patient goes double mask. So double masking is very important today. Even you're getting simple thin shields which you can wear, so there's no sort of exposure to the respiratory thing. So when you're stepping out into a small room, because many of the sonography rooms are small, you can do these precautions: double masking, shield, take your own sheets, and insist that either you are the first patient in the morning, or that the doctor has sterilized and sanitized the room either with the ultraviolet light or with the sprays or cleaning equipment before you go inside. So by these methods, I think you should be very, very safe. Sonography just takes a couple of minutes, so I think this should not be a problem. As far as the delivery goes, I think you need to be careful from the time you even select your hospital, because if it's a huge hospital with COVID and there's COVID patients and there's no separation between your normal COVID wards and your delivery wards, then you are a little bit worried, obviously. But like I said earlier, we are sticking now more to smaller hospitals, smaller nursing homes. In every place, there are COVID-free hospitals as well, which have been designated as COVID-free for whatever the special facilities that are being provided. So we are trying to use COVID-free hospitals. We're trying to go to smaller nursing homes, and each patient who comes in is tested. Not only the patient, but the husband or the caregiver is also tested. The staff is tested on a regular basis. Now, most of the hospital staff are all vaccinated. The medical personnel, healthcare, frontline workers have all been vaccinated. So all of them are vaccinated, or then they've been infected with COVID. So most of them are fairly safe. So the staff is safe. The patients are tested, and once you come into a facility where there is separation between the COVID and the non-COVID patients, I think you should be quite safe. So we've really not heard of, now it's been over a year, right? We're delivering patients in the pandemic. And we've really not had patients becoming positive during the time when they come for delivery and, the few days that they're in the hospital. So I think that part is pretty well taken care of. Patients are careless before that. They have a maid coming in, who's going to 3 houses and coming into their house, that kind of thing, or they are going here for shopping, or they're exposing themselves in various other ways where they don't even realize. So
Yeah.
those are
Yeah.
more risk factors than the hospitals.
So before we close, can you give five takeaways for our viewers today? What are the quick 5 points that they should keep in mind during the pandemic, especially if they're planning to conceive or they have conceived and are pregnant? Um, what would be your
Okay.
final thoughts?
So I haven't thought of 5 points as such, but I can actually suggest that if you're not pregnant at the moment, then seek counseling first before you plan the pregnancy. So talk to your gynecologist so you can have a very informed decision. And I always say this: COVID times or otherwise, your pregnancy should be planned. You should know what you're going into and how you're going to go through with this pregnancy. So pre-pregnancy, if you're planning, counseling is very important. If you are seeking infertility treatment, there are very standardized guidelines now for IVF centers and for the way IVF is conducted. So I think you should be quite safe in that format. You should go ahead with your treatment if it is a little bit urgent. If it is not urgent at all, you're a young patient with good number of eggs, no real risk factors, maybe you can delay your infertility treatment till you take your vaccinations, and after your second dose, wait for 3 or 4 weeks and then go in for your fertility treatment. If you are pregnant, obviously you are at a higher risk than a non-pregnant patient if you were to get COVID. And so take extreme precautions during a pregnancy. And if you do become positive, do not treat it lightly. Don't rely only on, say, a CT value or something. Be in constant touch with your physician. Be very careful with your monitoring, and seek hospitalization at the earliest if there is any deterioration of your symptoms or signs. And seek a delivery in a safe place. We hope that the government will allow vaccination of pregnant and lactating women soon. If that is the case, then go ahead and get vaccinated the moment the government opens it up. If vaccination at the moment is not allowed in India, so you take extreme precautions and make sure you select your hospital well, and all care is taken through pregnancy, delivery. Breastfeeding can be done, preferably by another caregiver if you are COVID positive. Express breast milk and give it safely to the baby to be fed to her. And once you recover 2 weeks into your COVID infection, you can breastfeed your baby directly. So I think that covers kind of the entire spectrum.
Thank you, Dr. Rishma Dilan Pai, for joining us today. Show us the certificate, Ritu.
Oh, lovely.
Yeah. I know a lot of people are asking in the chat box about Dr. KK Agarwal's health. He is stable, he is recovering, and he will be back very soon amongst everyone. I am his
We
daughter,
all
so I
pray
can
for
definitely thank everyone for the support and constant prayers for him. He will be back soon. Until then, we will meet you again tomorrow at 7 p.m. with another edition of the show. Keep watching Medtalks with Dr. KK Agarwal. Namaskar.
Thank you. Thank you, Nana.
Thank you.